If you want results like these, then pay close attention. And no, these results weren't achieved by expensive in-clinic treatments like lasers or microneedling. It was done exclusively with medical-grade skincare. My name is Dr. Roche. I'm an aesthetic physician specializing in skin health, mostly things like acne, pigmentation, and melasma. And I'm going to show you today how you can treat pigmentation from the comfort of your own home, without expensive in-clinic treatments, without downtime, and without pain. And as a special bonus, at the end of this video, I will show you exactly how you can get these products delivered straight to your door and pay less than half of what you would pay at your local clinic or retailer. Now, the first thing we need to discuss is the difference between over-the-counter medication and prescription medication. Now, the most important thing to remember is that prescription medication is going to be far more powerful because it's more potent, because it has a higher concentration of the active ingredient, but also because it penetrates to a deeper depth and therefore has a better result. Now, it's important to remember that when you use prescription grade products, because they're more powerful, they're more likely to suffer from certain side effects, things like redness, irritation, and flaking. That's why it's super important to make sure you get these products from a doctor and you stay under their guidance if you are to suffer any of these side effects. Now, let's compare this to over-the-counter medications. Now, these are products that you get from Boots or even expensive brands that you can't get from a doctor. And because of that, they're simply not going to be powerful enough to create any sort of meaningful change. I'm sure you've used lots of over-the-counter remedies in the past and seen not really any result. And that's probably why you're watching this video today. Now that we've gone through the difference between over-the-counter and prescription grade, let's go into the 4 categories of products that I like to prescribe for my patients to ensure complete resolution of their pigmentation. Now, the first category is an exfoliant of some kind. Now, this comes in different means. It can be a chemical peel, but a more accessible version will be an exfoliant of some kind, a daily wash. This can be either a AHA or a BHA, so an alpha hydroxy acid or a beta hydroxy acid. Essentially, these work by getting rid of the top layer of the skin. Now, we have multiple different layers of the skin. If we imagine the bottom layer is juicy, hydrated skin cells, and the top layer to be dead, dehydrated, and pigmented skin cells, what we want to do is to remove the top layer. If we get rid of the top layer, the lovely skin underneath tends to shine through, and your skin looks more polished. It's almost as if you're polishing your car and it just looks brighter after you've done the polish. Now, that's essentially how exfoliation works. The second category that I always like to prescribe for my patients is a vitamin A derivative of some sort. Now, the over-the-counter version of this would be retinols, and the prescription grade would be tretinoins. Now, they both work, but as we said before, the prescription grade will work far better. Now, it works by speeding up your cell turnover. So if we refer back to our analogy about the skin layers, essentially what we're trying to do is speed up that cell turnover. So if it takes normally 40 days to get from the bottom layer to the top layer, essentially we're speeding up that process. So the lovely baby skin is pushing the old skin out of the way. Now, this will manifest with a little bit of redness, irritation, and flaking, but that's not necessarily a bad thing. It's actually showing that the product is working. If you're not getting these symptoms when starting a vitamin A for the first time, it's likely because you're on too low a dose, and we should probably increase the dose to get these sort of side effects to show that the product is working. And if it is too much for you, there are certain things you can do to try and reduce those side effects, things like using a moisturizer, or perhaps even reducing the frequency in which you use vitamin A derivatives. Now, vitamin A derivatives like retinols and tretinoins are considered the gold standard of skincare because not only do they improve pigmentation, but they also improve general skin health. They do this through improving collagen synthesis, improving cell turnover, reducing sebum production, so you're not going to get as much acne breakouts. We can explain that in further detail in another lecture, and also improving acne scarring as well. So it really is the gold standard of skincare. Now, the third category that I always like to prescribe my patients is a tyrosinase kinase inhibitor. It's a fancy term. The main word that I want you to remember is hydroquinone. That's what you're going to be asking from your doctor. Now, let's think about why pigmentation happens in the first place. We all have melanocytes in our skin. These are cells that produce melanin. Now, those of us with darker skin tones will produce more melanin, and those of us with paler will produce less. However, due to things like age, stress, pregnancy, trauma, sometimes those melanocytes can become dysregulated, leading to overproduction of melanin, causing hyperpigmentation, but also underproduction of melanin, causing hypopigmentation or white spots. Now, the great thing about hydroquinone is that it works by regulating these melanocytes. So it stops overproduction, helping with the dark spots, but also stops underproduction, helping with the white spots. So it really is an incredible treatment for pigmentation specifically. Now, the last category that I always like to give my patients, although not prescription grade, is an SPF. Now, we all know that UV exposure or sunlight exposure is the biggest prognosticator for bad skin health, but especially pigmentation. So if you're not protecting your skin from those UV rays, you're going to significantly increase the chance of getting new and worse pigmentation. And if you don't believe me, just look at this picture of this lorry driver. Now, this lorry driver took the same route every single day, meaning that one side of his face was exposed to the sun and one side wasn't. And you can see from the picture that the side that was exposed looks significantly more damaged and pigmented. One side of his face looks 85 and the other side looks perhaps 50 years old. So hopefully this picture convinces you of the importance of SPF, to use something that's factor 50, broad spectrum, and to reapply every 2 hours, especially when you're out there in the sunshine. Even today, I'm indoors and I'm wearing my SPF because I know I'll get UV exposure through the window. So it's really important to wear your SPF every single day. Now we know the 4 categories that I like to prescribe my patients to get the best results: an exfoliant, a vitamin A, hydroquinone, and SPF. And the wonderful thing about all of these treatments is that they're completely pain-free, they're affordable, and they don't create any sort of downtime. Now, I promised that I would let you know exactly how you can get these treatments for less than half price. First of all, let's talk about the standing pricing model.
Now, usually you can get hydroquinone for around £100 to £120. And actually, tretinoin, which is usually sold as a separate cream, is around about the same mark. Meaning,
For these products, for a 3-month supply, you're looking at around £250, which is pretty expensive. Now, I've done something completely different. I've actually combined both of these medications into one cream, meaning it is far more affordable for you. In fact, less than half price of £250. Now, most doctors are aware of these treatments and they're aware of these products and they can prescribe them for you. Not as many know how to compound medications, how to combine them as I have, but many of them know about tretinoin and hydroquinone. So if you're interested in these products, simply approach your doctor and ask for them, and they will tell you whether you're suitable or not. If you don't have access to a dermatologist or an aesthetic doctor, you can simply book in a video consultation with me free of charge. And if you're based in the UK, I can send these products directly to your door. Now, if you have any questions whatsoever about any of these products or pigmentation in general, be sure to drop them in the comments below. Make sure to like, share, and subscribe for more content because I talk about skin all day, every day. Remember, guys, skincare doesn't have to be difficult, and getting rid of your pigmentation doesn't have to be ridiculously expensive. You just need the right treatment plan.